Hello, my name is Dr. Atlee Wampler with the Perimeter Spine and Rehabilitation Center. We're a state-of-the-art integrated physical medicine facility that specializes in spinal disc regeneration and joint rejuvenation. 90% of our patient population is going to get 90% better, just doing 90% of our conservative protocols. But there's always 10% of our patient population that will not respond to our therapeutic protocols because they've just had so much degenerative changes or they've waited so long to seek treatment. And that's why I'm so proud to represent and to be associated with Dr. Chitale at the premier Neurosurgical Institute. Dr. Chitale has had over 34 years of clinical experience in neurovascular surgery, and he has served the Atlanta population for almost 10 years now. And he specializes in the treatment of brain, spine, and peripheral nervous system. Dr. Chitale, when a patient fails with our conservative treatments and we send them to your facility, what are the various treatment protocols that a patient could experience?
In short, when patients show up, they have a typical complaint of pain in some portion of their body, especially the midline spine. There is weakness or numbness or loss of function. Depending on their complaint, we do a good physical examination to pin it down about where the problem lies. And that we call a diagnostic workup.
Yes, sir.
Within that, we also take X-rays and MRI scans. That actually localizes those symptoms and allows us to correlate what patient told us as their complaint to the area of interest where the MRI is actually showing us a problem. Now, once the problem is detected, then we customize the treatment for that particular patient. Now, that treatment will then include a conservative treatment, a semi-conservative treatment, and an aggressive treatment. Within the conservative portion of the treatment, there is a medical treatment that just writing prescriptions for pain medications, muscle relaxants, etc., or providing with a brace, a TENS unit, an ultrasound treatment, or spinal decompressive therapy. Now, those are called conservative treatments. My office does not provide the conservative treatment, but we rely on a place like yours,
yes, sir,
for example, that allows us to treat those patients in a fashion that is a continuity of care.
Right.
And those patients feel very comfortable because now they have two physicians to work with them.
Co-managing their care.
Co-managing their care.
Right.
After that treatment is over and some of the patients have gotten better with your care, obviously some may or may not.
Right.
And depending on their progress, they need to come back to us, at which time we will formulate another plan of treatment that would be somewhat more aggressive, but not surgery yet.
Where would they start?
Within that portion of the treatment, there is a pain control measure.
Mm-hmm.
Now, we have already tried oral medications.
Right.
But since they failed, the injection portion of the treatment that targets the area, now especially in the spine, there could be a pinched nerve, for example.
Correct.
And the pinched nerve could be from a bad disc, or could be a swelling in the joint.
Spinal stenosis.
Spinal stenosis. Those are ideal patients,
sure,
for injections. Now, injections are done in number of areas of the spine. When they are done in a space around the nerve, we call them as epidural injections.
And what do you use? Is that when you use corticosteroids?
Yes, it's a combination of a steroid mixed with a Novocaine or Marcaine, which is an anesthetic.
Right.
That helps to kill the pain at the time when we do the injection.
And remove the inflammation.
And the steroid portion of it,
yes,
that actually helps to maintain that improvement on a long-term basis.
Right.
Depending on how long that improvement is going to last, we could either repeat the injection 2 or 3 times, or some patients actually get one injection and they're completely pain-free.
Yep.
And they love it.
We've seen it.
So if those patient populations are now taken care of with injections, very few may be left who are still not better.
Right.
In those patients, we are still able to offer surgical treatment. And now within the realm of surgical treatment, we do lots of patient care. The simplest portion would be a minimally invasive lumbar disc surgery. That would mean microdiscectomy. Incisions are small, procedures are small, they are less than 1 hour long, hospital stay is small, patients get to go home the next day.
That's fantastic.
In that scenario, they have not lost work, they are pain-free on the day of surgery, and now they only have to recoup themselves and get back in shape.
Right.
Now that's where you come in.
Right.
After I have taken care of them, then you can do core muscle strengthening exercises and help them to achieve the goal that they are not going to get hurt again in the process. So once the patient has gone through this experience of back surgery or conservative treatment or injections, at some point in time, patients become very cautious. And at times they are very afraid to do things.
Right.
But if you are able to core muscle strengthen them, they can get back to their normal physical activity and don't have to be afraid to do things. And that is the real goal we too can achieve.
That's right. And that's why we're so appreciative of the relationship that we have with Dr. Chitale and Premier Neurosurgical Institute here in Marietta, Georgia. Because really, we're just trying to get ideal outcomes for our patient population. Thank you for joining us at this episode, and we'll look forward to seeing you in next month's episode